Welcome. The following is a presentation on the theory of humanism and its evolution and integration into social work practice. This presentation is titled, We Are Only Human, Analysis of the Person-Centered Approach in Principle and Practice. Humanism is a concept that focuses on acknowledging the self-worth of every individual. Through this lens, all individuals are believed to be capable of self-determination, which Bistek defines as the practical recognition of the right and need of clients to freedom in making their own choices and decisions. With this focus on self-worth and self-determination, human welfare takes a prominent position in humanism, as does the promotion of interests, values, and dignity of humanity as a whole. Under humanism, people are viewed as rational human beings with the capacity for truth and goodness, and people are viewed as pro-social and capable of growth, resulting when one's emotions are processed, and the discovery of meaning is found within each experience. Humanistic ideology is the foundation under which the client-centered approach was developed by Carl Rogers in the early 50s, and this approach is also known as the person-centered approach. Carl Rogers was a psychologist and researcher. He developed the client-centered theory while leading a counseling center at the University of Chicago. His work is considered by some to be highly influential in social work practice, both historically and within modern practice models today. Rogers focused on a humanistic, non-directive approach to practice. He said, "A professional's personal presence is integral in the expression of therapeutic attitudes. This places value on the relationship between the client and the practitioner as genuine and non-hierarchical and grounded in trust. In this context, non-hierarchical refers to an attitude toward therapy as a mutual activity in which dialogue is open and collaborative. The client-centered approach is similar to the strengths perspective in that it focuses on using client strengths when addressing problems. It offers the potential for personal growth and development and concentrates less on techniques and more on freedom of choice while providing a safe environment for the client." This slide lists some of the core components of the client-centered approach: acceptance, unconditional positive regard, which can be practiced through sincere and genuine interactions that don't involve conditions and communicates to the client warmth and care; authenticity of the professional; empathic understanding, which helps clients be less self-blaming and leads to greater self-acceptance. Self-actualization is a process of personal growth resulting in fulfillment. It bears noting that self-actualization is a continual journey to be experienced, not an end state to be attained. So self-actualization actually continues throughout the client's life, even after the therapeutic relationship is terminated. Incongruence is a factor in which a client is experiencing anxiety and the client is facing a conflict in their self-worth. Incongruence is also seen as the reason a client has unresolved issues like grief or guilt or feels incapable or worthless in daily life. Congruence occurs through the practitioner modeling self-image and requires an attitude of openness by the professional to his or her own inner experiencing, as well as a disciplined attention to the flow of experiencing within the client. With all of these components, the goal of the social worker is to build up the client's sense of self-worth, and self-acceptance through positive interactions. Another factor involved with the client-centered approach is healthy boundary setting for the practitioner, which helps to avoid becoming overwhelmed by the experiences of their clients. In this regard, the practitioner practices empathic understanding in themselves as well as their clients. As far as the influence on practice and social work as a whole, the social work and counseling professions began calling the people that they worked with clients rather than patients. And this really has a foundation in humanism because the term patient infers that there is an illness, and the term client infers that there is a relationship. Practitioners embrace self-determination in lieu of or in combination with other mental health approaches, and integration of humanism into the National Association of Social Workers Code of Ethics 6 core values occurred when 2 of those values were listed as the dignity and worth of a person and valuing the importance of human relationships. Concepts of humanism integrate well with all kinds of therapies and approaches by establishing a positive therapeutic relationship without hierarchical positioning of the practitioner over the client. With all therapeutic interventions, practitioners approach each interaction with genuineness and each client with unconditional positive regard, as discussed in the previous slides. So these person-centered concepts complement therapeutic techniques that promote congruence and change. Some examples include motivational interviewing, which is a process that fosters personal change within a client by utilizing a client's intrinsic motivation for change. Art therapy is another intervention which involves client-centered components, and it's often used with clients that are processing trauma. Finally, mindfulness is a practice that requires one to become accustomed to practicing presence, awareness, and acceptance, all of which are components of the client-centered approach. Some important points involved in the practice of client-centered theory are listed here. Engagement takes place as the practitioner is a partner in the process. Assessment occurs at the beginning of a therapeutic relationship and continues throughout the process. It involves collecting of information by the social worker that helps to generate understanding of the client's needs and current state of emotion. Goal setting is a collaborative process under this theory, and it must be non-hierarchical like all interactions within client-centered practice. Goals are often explored in verbal discussions in the client-centered approach rather than involving contracts. Goal setting helps to examine the parts of a client's life in which they want to experience personal growth, leading to the goal of self-actualization. Intervention occurs throughout the process from beginning to end because the client-centered approach focuses on the professional relationship. As discussed earlier, the concepts of congruence, unconditional positive regard, and empathy are interwoven throughout every aspect. So intervention is just one more thing that is especially present throughout, so that the client's self-image is constantly being lifted and anxiety steadily slipping away. Termination is important under client-centered theory because of the relationship that is formed and nurtured during the process. As the client grows and changes to the point that they are self-actualizing and their self-image is no longer causing anxiety and incongruence, it is important to release the therapeutic process and important for the social worker to share their feelings on this release and termination in order to continue the genuine interaction throughout its completion. Finally, evaluation continues as positive outcomes are acknowledged, and hopefully incongruence gives way to self-actualization, and this is discussed and affirmed. A couple examples of ideal populations that can benefit from a client-centered approach are substance use clients and mandated clients. Substance use clients are often struggling with self-image as a result of their addiction and subsequent behaviors. Because the client-centered approach focuses on positive change, addressing anxiety that comes from incongruence and self-actualization, substance use clients are a population that can benefit from this approach, and it's often in combination with motivational interviewing or other interventions. Mandated clients are a difficult population because they often do not want to be involved with social workers but are court-ordered to do so. When a client-centered theory is involved in the interactions with mandated clients, the relationship comes first, and it helps to foster trust in the interactions that take place. This will promote the client's investment in the process, even when the process is taking place as a result of criminal justice or child welfare mandates. The client-centered approach is broad in context, making it appropriate for numerous practice settings. It's applicable for micro, meso, and macro social work. It's useful for cross-cultural client systems and in multicultural settings since it's non-directive, non-hierarchical, it uses unconditional positive regard, and it prioritizes the client position. In this approach, the client is the expert. So no matter what their cultural background is, they are the expert and they're the one that really leads the process. Some strengths of humanism are that, as previously mentioned, humanism is aligned with social work's commitment to respecting the dignity and worth of a person and the importance of human relationships. It can be applied to a broad range of clients, which makes it also ideal for diverse populations. Some limitations of humanism and the client-centered theory are that there is little empirical support for client-centered therapy as a whole. The non-directive nature of humanism offers clinicians few guidelines to follow because the focus is on the relationship and not a strict adherence to an itemized process with to-dos and to-don'ts. It's not time efficient. The process relies on the change process that is client-led and follows their own timeline, and this can create problems for insurance billing and coverage under the strict therapeutic timelines that are set by the health insurance industry. They want therapy to have a clear beginning and end. Also, client-centered therapy is often seen as simplistic and unrealistically optimistic. It can also be ineffective in helping those who do not want change, such as those mandated clients previously mentioned. If the client does not see the need for change, the client will not want to participate in the relationship and the change process. Here are some references if you want to learn more about humanism and the client-centered approach. Thank you for watching.